Basically, somatoform disorders are disorders that are problems that appear to be medical but are due to psychosocial factors. So for example, have you heard of a story who you might have seen people who have like physical pains, but they can't when they examine the body, there seems to be no biological cause of this pain, right? Or sometimes people suddenly go hysterically blind and they can't see, and there's no biological reason that they can't see. And those all fall under the form of somatoform disorders. So basically, these are psychological problems disguising and expressing themselves through physical means. We're going to talk about a couple of them, 3 of them called the somatic body disorder, the somatic disorders, conversion disorder, and also hypochondriasis. You might have heard the term hypochondriac, and that's basically the same disorder that is. So basically, somato means body. So somatoform disorders means disorders that relate to the body. And there's somatic disorders relate directly to the body. So in the somatization disorders, people with this kind of disorder have many long-lasting physical ailments that have little or no organic basis. And so, for example, patients in this case would have like a pain in the arm, and they'd go to the first doctor, and the doctor says, well, it looks like there's nothing wrong neurologically or in the nervous system, so we don't understand it. And so, but the pain in the arm still persists, and what they find themselves doing is going from doctor to doctor, looking for people that would treat the arm for a biological medical reason. Usually it's when doctors realize that the patient has gone to many different doctors, that they suspect there might be a psychological reason behind it. Let's move on to the next one, is the conversion disorder. In this disorder, a psychosocial conflict or need is converted into dramatic physical symptoms that affect voluntary or sensory functioning. Basically, in conversion disorder, the most common kind is, the most known kind is called something like hysterical blindness, where for some reason people's vision suddenly disappears and they can't see anymore. And there's no biological reason. For example, Woody Allen made a movie called Hollywood Endings, where he plays a director and all of a sudden he loses his sight right before the movie starts. And so understanding this is there's actually like a psychosocial kind of situation that causes this. So in Woody Allen's case, it was starting a new movie, being pressured to succeed. There's like a wife and son issue there, all kind of linked up together. So symptoms often seem neurological, such as paralysis, blindness, or loss of feelings. So in addition to just losing your sensation of seeing, people often feel paralysis, they can't move their arm anymore, or they feel like numbness, they can't actually feel anymore. So the time frame of when this occurs actually is between late childhood and young adulthood, and they usually appear suddenly and are thought to be very rare. So even though it sounds very metaphorical, that for example, in one of Freud's early cases, there was a patient who suddenly lost use of an arm, right? It became numb and they can't control it. And Freud looked at kind of the conflicts in that person's life and came to the conclusion that that person was actually deathly afraid of masturbating. And so one way that anxiety manifested is by the loss of use of his arms, right? So it's kind of metaphorical and symbolic in that Freudian sense, that if there's something you really, really don't want to see, then you go hysterically blind, or if there's something you don't want to feel, then you lose that sense of feeling. Again, this is a very rare disorder. And the final one is the hypochondriasis. People with hypochondriasis unrealistically interpret bodily symptoms as signs of serious illness. So when we describe the term hypochondriac, you might have used this term before, and this is basically for someone who is looking for a disease. They often feel that they're falling sick, and that they're getting seriously ill, getting like cancer, skin cancer, heart diseases, and they go to doctors for really minor issues that have no medical threat. You might have heard of this new disease called WebMD disease, and it's kind of a variation of hypochondriasis. And this is the thing that people often go online and they read WebMD, which is an online kind of a Wikipedia for medical diseases, and they kind of look at the symptoms, and as they read more about the symptoms and diseases, they start feeling that they have those diseases, that they could feel certain pains in their body, and they want to agree with WebMD, and so they kind of have developed these strange self-diagnoses, and they go to the doctor and confront them. Oftentimes their symptoms are merely normal bodily changes such as occasional coughing, sores and sweating, and so these kind of little things people kind of over-exaggerate. They see as a major threat to their life, and they kind of interpret it as illnesses. There's another phenomenon called the medical student disease, which is very similar to the WebMD, whereas a lot of doctors, while they're studying to become doctors, anatomy, medicine, so on and so forth, they start seeing the symptoms they read in the book in their own bodies. Again, this is another example of they kind of can misinterpret the symptoms as occurring on their own. So although some patients recognize that their concerns are excessive, many do not. So there's kind of two things going on here, that they could see that their concerns are kind of exaggerated, yet they can't even help themselves to go see a doctor. They're kind of overly anxious. They can't function correctly until they see a doctor to confirm whether that disease. Others see it as a normal sign of being aware of your bodily function. There's one other disorder called the Factitious Disorder under the Somatic Disorders. And basically this is called Munchausen syndrome. You might have heard of this before or seen a movie where this occurred, where a patient starts purposely harming themselves to seek medical attention. So they'll develop cuts, they'll fake certain diseases like sweating, headaches, they'll take chemicals that will mimic chemical diseases, and they want to seek medical help after they do this. Again, this is very dangerous, and one reason that people develop Munchausen syndrome is because they like the attention people get when they are thought to be sick, right? So they purposely sicken themselves to relieve that attention. There's another term called Munchausen by proxy. And this is when caregivers of children who are sick purposely keep their children sick or harm their children in order for their children to remain ill, and so to continue seeing doctor. And this is kind of a very serious thing, because there have been cases where parents poison or cut or seriously put their children in harm's way just so the child can remain ill. You might have seen the movie The Sixth Sense, where that occurs, where a young girl was systematically poisoned by her mother, such that her mother can receive the sympathy from her cousins, from her family members and friends, and so they get that kind of positive attention. Unfortunately, the girl comes back as a ghost and tells people about it, which is not part of the Munchausen syndrome. That's just pure M. Night Shyamalan fantasy. And so it seems like in this case, there's a series of different kind of disorders related to wrongly thinking that there's something wrong with their body. Another common disorder is called body conversion disorder. And this is kind of related with eating disorders, where some people sometimes look in the mirror and see some kind of imperfection in their body. They actually imagine something wrong with their body, for example, that they're too fat, or they have too many wrinkles, or they have certain like scars and moles. This is, again, they have just a wrong vision of their body. So they are able, if you're a Freudian psychoanalyst, you would say that they have these anxieties, and it manifests by false delusions about their own body, right?